ಮಂಗಳೂರು ಕಂಕನಾಡಿಯ ಒಮೆಗಾ ಆಸ್ಪತ್ರೆ ಪ್ರೈವೇಟ್ ಲಿಮಿಟೆಡ್ ಆಸ್ಪತ್ರೆ ವತಿಯಿಂದ ಅಕ್ಟೋಬರ್ 16ರಂದು ಉಚಿತ ಸ್ತನ ಶಿಬಿರ ನಡೆಯಿತು. ಆಸ್ಪತ್ರೆಯ ಹಿರಿಯ ಲೇಡಿ ಸರ್ಜನ್ ಉಚಿತವಾಗಿ ತಪಾಸಣೆ ನಡೆಸಿದರು. ಉಚಿತ ಸ್ತನ ಶಿಬಿರವನ್ನು ಆರ್ಥೋಪೆಡಿಕ್ ಸರ್ಜನ್ ಡಾಕ್ಟರ್ ಮಹಾಬಲ ರೈ ಉದ್ಘಾಟಿಸಿದರು. ಕಾರ್ಯಕ್ರಮದಲ್ಲಿ ಸ್ಥಾಪಕ ನಿರ್ದೇಶಕರಾದ ಡಾಕ್ಟರ್ ಜೋಯಿ ವೇಗಸ್ ಎಂಡಿ, ಹಿರಿಯ ಕನ್ಸಲ್ಟೆಂಟ್ ಸರ್ಜನ್ ಡಾಕ್ಟರ್ ಲೀಲಮ್ಮ ಥಾಮಸ್ ಉಪಸ್ಥಿತರಿದ್ದರು. ಉಚಿತ ಶಿಬಿರದಲ್ಲಿ ನೂರಾರು ಮಂದಿ ಪಾಲ್ಗೊಂಡು ಶಿಬಿರದ ಪ್ರಯೋಜನವನ್ನು ಪಡೆದುಕೊಂಡರು.
To offer something which is very important for a lady. You know, diseases can happen to men as well as females, but there are some diseases which are peculiar to females mainly, and it is for that we are having a screening thing, and we are happy that you have turned up and taken advantage of our camp, which is actually run by Dr. Tangam Joshua. She is a plastic surgeon. She is retired head of the Department of Surgery at Kasturba Medical College, and she has been dealing with lot of breast cases. Maybe she has done around 1,000 cases of cancer breast operations itself in her career of about 50 years. And now she has her main thing is to see and treat patients and see that this complication does not develop. And she has done her surgery MS and then MCH, but I think her greatest qualification is she is my younger sister, and I welcome her. I also welcome Dr. Leela Thomas, who is a most senior surgeon, I should say, in the state perhaps. She is actually the mentor of Dr. Tangam, and she has been working in many places as a consultant surgeon, but now she has retired actually and spends her time mainly in treating and perhaps comforting old people, especially who have surgical problems. Dr. Leela Thomas, we welcome you heartily for this.
Women 4 might get it, but the good thing is if it is detected early with the modern chemotherapy and other medications that we have, the life expectancy is quite good. Before it is like cancer means it's a death knell. It's no longer so. And that is what is encouraging, and that is what is motivating us to make a diagnosis as early as possible. And the first person who will notice that something is wrong with their breast will be the patient herself. Among all the cancer patients that we treat, at least 40% come with the complaint saying that there is a lack. It's a very few who may have noticed but didn't want treatment because of the fear. So it would be good to just say a few words about how we can examine our breast. And no one will be more attuned with the nature of our breast other than ourselves. So the breast examination, or what is known as the self-examination of the breast, it has got two methods. One is the visual way of knowing that something is wrong. Second is the physical examination. It doesn't need a doctor actually. The doctor is there to confirm or to say that no, what you're feeling is not a malignancy, don't be afraid, because not all lumps are malignant. But what happens is whenever a lump is found by the patient, they get into the mode of panic and they don't want to show it. That should not be so, because most of the lumps are benign and doesn't necessarily mean that any lump in the breast is a cancerous disease. So the visual part of it is where the patient stands in front of a mirror and see whether there is something she feels is new, something that doesn't look normal for her breast. It could be that one thing that we have to realize is no two breasts of the person, that is the right breast and the left breast, it is not going to be symmetrical. Just as our right half of the face, the left half is not perfectly symmetrical. So there are patients who come and say that one breast is bigger, but it's normal. Understand? So when you look into the mirror, the things that you have to notice, whether you find a bulge which was not there, or one breast which has become noticeably bigger and seem to have lost the normal shape, or there is a dimpling or puckering of the skin as though it is a scarred tissue. That is one of the things that will indicate that it needs to be properly examined. Or if the nipple gets retracted inside, it should be outward, it should be outside, but it slowly gets absorbed or retracted. We call it a nipple retraction, but this nipple retraction can be of a congenital nature. So when a doctor sees a retracted nipple, the first thing we have to ask is, from how long has it been there? And if the patient says, since at that time I remember, see, don't hold it by the fingertips. If you were to hold your breast with your fingertips, it will be lumpy throughout. That's a normal breast tissue. And many patients come to us saying that I can feel that lump. Then I take the other breast, in which she has not gone to examine in detail, and I tell her, is there a lump here? She says, oh, there also there is a lump. But that's a normal. You have to examine with the pulp or the pad of the fingers, like that. Use your right hand to examine your left breast and the left hand to examine the right breast with the pad of the fingers. It can be done when you are under the shower, and it can be confirmed by lying down on your back on a hard mattress, and then you palpate every area of your breast. And it will be nice that you don't forget a part. So you think of the clock, start from 12 o'clock onwards, go in a radial fashion, from the nipple areola go to the periphery of the breast, then go to 1 o'clock, 2 o'clock, in which case you are not likely to miss out. If it is done in a haphazard manner, there might be one spot that you are missing. And we have to remember that a part of the breast is in the armpit. So palpate the armpit also. And then you find that there is a lump. When you palpate with your finger pads, then you do a more detailed examination. And then go to the top. And mostly it would be a fibroadenoma or a fibroadenosis cyst. There are other diseases of the breast also, which can be tackled especially by the plastic surgeon, to augment a breast which is small, to reduce the breast size, especially in that virginal hypertrophy where the back gets bent and it becomes painful for the patient to bear the weight. It can be reduced. Reduced in size but not in shape. That is where cosmetic surgery comes into it. It can be an infection of the breast, especially when the mother is lactating, feeding the baby. That has to be taught to the patient, that milk should not stagnate in the breast. Baby might sleep off and the milk remains there. It gets infected and an abscess occurs. So you'll have to pump out the milk. Don't allow it to get stagnant. So these are the common diseases. Fibroadenoma is where the lump can be, it's a hormonal problem. Fibrocystic disease is a hormonal problem. But the main thing that we are we all think of is not to have a cancer, and God willing, none of us may have, but let us not be complicit in ignoring it, because treatment is good. And a person whom I had operated long back was the head mistress.
ಜನರಿಗಾಗಿ ಹೆಂಗಸರಿಗಾಗಿ ಒಂದು ಫ್ರೀ ಬ್ರೆಸ್ಟ್ ಕ್ಯಾಂಪ್ ಆರ್ಗನೈಸ್ ಮಾಡಿದ್ದೇವೆ. ಅದಕ್ಕೆ ಹೆಚ್ಚಿನ ಮಂದಿ ಹೆಂಗಸರು ಇವತ್ತು ಬಂದು ಈ ಶಿಬಿರವನ್ನು ಒಳ್ಳೆಯ ಯಶಸ್ವಿನಿಯಾಗಿ ಸಕ್ಸಸ್ ಆಗಿ ಮಾಡಿದ್ದಾರೆ. ನಮ್ಮ ಹಾಸ್ಪಿಟಲ್ 21 ವರ್ಷ 22 ವರ್ಷ ಆಗಿ ನಾವು ಜನರಿಗೆ ಸೇವೆ ಮಾಡ್ತಾ ಇದ್ದೇವೆ. ಮೊದಲು ಕಾರ್ಡಿಯಾಲಜಿಯಲ್ಲಿ ಆಂಜಿಯೋಗ್ರಾಮ್, ಆಂಜಿಯೋಪ್ಲಾಸ್ಟಿ ಮತ್ತು ಬೈಪಾಸ್ ಸರ್ಜರಿ ಆದದ್ದು ನಮ್ಮ ಜಿಲ್ಲೆಯಲ್ಲಿ ಇದೇ ಒಮೆಗಾ ಹಾಸ್ಪಿಟಲ್ನಲ್ಲಿ. ಈಗ ನಾವು ಅದನ್ನು ಕಂಟಿನ್ಯೂ ಮಾಡ್ತಾ ಇದ್ದೇವೆ. ಆದರೂ ಹೊಸ ಫೀಲ್ಡಿಗೆ ನಾವು ಸೇವೆ ಮಾಡಲಿಕ್ಕೆ ಈಗ ನಾವು ತಯಾರಾಗಿದ್ದೇವೆ. ಈಗ ಒಮೆಗಾ ಹಾಸ್ಪಿಟಲ್ನಲ್ಲಿ ಒಂದು ಹೊಸ ಮ್ಯಾನೇಜ್ಮೆಂಟ್ ಆಗಿದೆ. ಮಿಸ್ಟರ್ ಇ ಸೆಲ್ವರಾಜ್ ಎಂಬವರನ್ನು ಇಂಡಿಪೆಂಡೆಂಟ್ ಚೇರ್ಮನ್ ಆಗಿ ಅಪಾಯಿಂಟ್ ಮಾಡಿ ಅವರೇ ಇದು ಹಾಸ್ಪಿಟಲ್ನ ಆಡಳಿತ ಮಾಡ್ತಾ ಇದ್ದಾರೆ. ಅವರು ಕೆಲವು ನನ್ನಂತಹ ಡೈರೆಕ್ಟರ್ಸಿನವರಿಗೆ ಮತ್ತು ಡಾಕ್ಟರ್ ಜಯಕೃಷ್ಣನ್ ಕಾರ್ಡಿಯಾಕ್ ಸರ್ಜನ್ ಅವರಿಗೆ ಇದರದ್ದು ಕೆಲವು ಉತ್ತರವಾದಗಳನ್ನು ಕೊಟ್ಟಿದ್ದಾರೆ. ಅದರ ಭಾಗವಾಗಿ ನಾವು ಈ ಫ್ರೀ ಬ್ರೆಸ್ಟ್ ಕ್ಯಾಂಪನ್ನು ನಾವು ಇವತ್ತು ಇಲ್ಲಿ ಕಂಡಕ್ಟ್ ಮಾಡಿದ್ದೇವೆ. ಕ್ಯಾನ್ಸರ್ ಎಂದು ಹೇಳಿದರೆ ಎಲ್ಲರಿಗೂ ಹೆದರಿಕೆ ಉಂಟು. ಅದು ಗಂಡಸರಿಗೂ ಹೆಂಗಸರಿಗೂ ಬರಬಹುದು. ಆದರೆ ಹೆಂಗಸರಿಗೆ ಪರ್ಟಿಕ್ಯುಲರ್ ಆಗಿ ಇರುವುದು ಒಂದು ಎಂದರೆ ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್, ಇನ್ನೊಂದು ಎಂದು ಹೇಳಿದರೆ ಯೂಟ್ರಸ್ ಒಂದು ಕ್ಯಾನ್ಸರ್. ಅದಕ್ಕಾಗಿ ನಾವು ಈ ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರನ್ನು ಮೊದಲೇ ಗೊತ್ತು ಮಾಡಲಿಕ್ಕೂ ಅರ್ಲಿಯಾಗಿ ಡಿಟೆಕ್ಟ್ ಮಾಡಿ ಅರ್ಲಿಯಾಗಿ ಟ್ರೀಟ್ ಮಾಡಿದರೆ ಇದೊಂದು ದೊಡ್ಡ ಸೀಕೆ ಅಲ್ಲ. ಎಷ್ಟೋ ಮಂದಿ ಆಪರೇಷನ್ ಎಲ್ಲ ಮಾಡಿ 25-30 ವರ್ಷ ಬದುಕ್ತಾರೆ ಸಂತೋಷವಾಗಿ. ಅಂಥ ಒಂದು ಇದಕ್ಕಾಗಿ ಅವೇರ್ನೆಸ್ಸಿಗಾಗಿ ಎಲ್ಲರಿಗೂ ಇದು ಗೊತ್ತಾಗುವ ಹಾಗೆ ಎಲ್ಲರೂ ಇದರ ವಿಷಯ ನಾಚಿಕೆ ಮಾಡದೆ ಎಲ್ಲರೂ ತನ್ನ ತಾನೇ ಎಕ್ಸಾಮಿನ್ ಮಾಡಿ ಬೇಕಾದಾಗ ಡಾಕ್ಟ್ರನವರನ್ನು ಸಲಹೆ ತಗೊಳ್ಳಿಕ್ಕೆ ಮಾಡಲಿಕ್ಕೆ ಈ ಕ್ಯಾಂಪನ್ನು ನಾವು ಆರ್ಗನೈಸ್ ಮಾಡಿದ್ದೇವೆ. ಇದರಲ್ಲಿ ನಮ್ಮೊಟ್ಟಿಗೆ ಸಹಕರಿಸಿದ ನಮ್ಮ ಎಲ್ಲವರನ್ನು ನಾವು ಥ್ಯಾಂಕ್ಸ್ ಕೊಡ್ತೇವೆ. ಎಸ್ಪೆಷಲಿ ಮಲೆನಾಡು ನರ್ಸಿಂಗ್ ಇನ್ಸ್ಟಿಟ್ಯೂಟ್ನವರು ಇದೆಲ್ಲ ನಮ್ಮ ಆರ್ಗನೈಸೇಷನಲ್ಲಿ ಹೆಲ್ಪ್ ಮಾಡಿದ್ದಾರೆ. TV ಚಾನಲ್ನವರು 9 ಅವರು ಹೆಲ್ಪ್ ಮಾಡಿದ್ದಾರೆ. ಇವರಿಗೆಲ್ಲ ಪ್ರೆಸ್ಸಿನವರು ನಮ್ಮನ್ನು ಹೆಲ್ಪ್ ಮಾಡಿದ್ದಾರೆ. ಇವರಿಗೆಲ್ಲ ನಮ್ಮ ಕೃತಜ್ಞತೆಗಳನ್ನು ನಾನು ಒಮೆಗಾದ ಪರವಾಗಿ ನಾನು ಕೋರಿಸ್ತೇನೆ. ಮಾತ್ರವಲ್ಲ, ಇನ್ನು ಮುಂದಕ್ಕೂ ನಮಗೆ ತುಂಬ ಇಂಥ ಕ್ಯಾಂಪ್ಸ್ ಡಿಫ್ರೆಂಟ್ ಸ್ಪೆಷಾಲಿಟಿ ಜನರ ಗೊತ್ತು ಮಾಡಲಿಕ್ಕೆ ಟ್ರೀಟ್ಮೆಂಟ್ ಮಾಡಲಿಕ್ಕೆ ಕ್ಯಾಂಪನ್ನು ನಾವು ಕಂಡಕ್ಟ್ ಮಾಡಲಿಕ್ಕೆ ನಿರ್ಧರಿಸಿದ್ದೇವೆ. ಎಲ್ಲರದ್ದು